Hi everyone, it's currently April 2020 and I hope everyone is doing well during the COVID-19 pandemic. My name is Justin Liu and I'm a medical student at McMaster University located in Hamilton, Ontario, Canada. Today I want to discuss our recent publication in the British Journal of Dermatology called Identification and Evaluation of Outcome Measure Instruments in Pyoderma gangrenosum, a systematic review. Pyoderma gangrenosum, also known as PG, is a rare inflammatory skin condition that results in painful ulcers that progressively grow and is difficult to heal. PG affects only 3 to 10 people per million per year, and due to its rarity, there's a lack of validated tools for assessing the effectiveness of treatments, and this results in the absence of a uniform standard of care. As a result, we conducted 2 systematic reviews, which one, aim to identify all the current tools used in measuring outcomes in PG clinical trials, and 2, to evaluate the validation surrounding these instruments using the Cosmin guidelines. To identify outcome measurement instruments for PG, we searched the Medline and Embase databases from inception to November 2019 for clinical trials involving PG. For PG instrument validation studies, we used a search strategy by Cherwi et al., which is also found on the Cosmin manual, and it basically uses a PubMed search filter for finding studies on measurement properties. To evaluate these measurement properties and their methodological quality, we used the 2018 Cosmin Risk of Bias checklist to assess properties such as content validity, structural validity, and internal consistency. The result of each study on a measurement property was rated against the criteria for good measurement properties based on Princeton et al., and each result was rated as either sufficient, insufficient, or indeterminate. For methodological quality, the Cosmin Risk of Bias checklist was used, and it utilizes a 4-point rating scale of very good, adequate, doubtful, and inadequate for each measurement property, and is based on the lowest rating for each item assessed. In terms of results, we found that outcome heterogeneity is very significant in PG clinical trials, with 20 outcome measurement instruments used in 7 clinical trials, and within that, 14 instruments used in 2 randomized control trials. Of these, 17 out of the 20 instruments lacked validation data entirely. The remaining 3 validated instruments were speed of healing, physician global assessment, and resolution of inflammation. However, these 3 instruments lack validation for half of the Cosmin categories. Within dermatology, new instruments are constantly being developed for the assessment of different skin disorders. However, the collection of clinical trial data and analysis for either systematic reviews and guidelines are only possible if the underlying clinical trials utilize the same validated outcome measurement instruments. We conclude that more validation studies are required for existing PG instruments, and new instruments may need to be developed to help create a consensus on measuring outcomes for pyoderma gangrenosum. Once there is a consensus, treatments for pyoderma gangrenosum can be compared to each other using the same instruments to identify novel, effective therapies for this debilitating disease. Thanks for listening, and I hope you all have a wonderful day.